Safinamide is used as an add-on therapy in Parkinson's disease. Is a MAO-B inhibitor, but it has not been yet extensively studied between its efficacy and safety between different age groups. So in our movement disorders unit, we tried to study if there were any differences between efficacy, safety, and also tolerability in Safinamide between two different groups, meaning under 70 years old versus over 70 years old. So results show that there were statistical significance in almost all motor and non-motor variables with Safinamide, especially at 1 year of treatment, and especially regarding bradykinesia, morning akinesia, and also wearing off. Especially at 1 year of treatment, regardless, and it was a surprise, regardless of age. Also with our work, we could see that there were some variables that could predict unresponsiveness to Safinamide's treatment. And they were especially postural instability that would increase almost 8 times the probability of non-response to Safinamide, and also cognitive impairment that doubles the probability to non-response to this treatment. So although our study was limited by the sample size, which was almost 51 patients, it can show that there are some important variables that can predict the non-responsiveness to our treatment, and also that maybe the efficacy of Safinamide is not that much dependent on age as we thought previously. So they were the main conclusions of our work with Safinamide. Yeah, we know there is no formal indication to prescribe Safinamide in patients over 70 years old, and we try to see any differences because we don't have large-scale studies of this, as I mentioned before. With our work, although the sample, as I told you, is not that larger, is almost 50 patients. Maybe we can review those guidelines, those indications for this treatment, because it's in our population. It really helps patients regardless of age, especially, as I told you, in bradykinesia, morning akinesia, also wearing off, that are some non-motor fluctuations that influences the quality of life of our patients. So mainly when we prescribe this drug, we should not only see the age of the patient, but also especially we should see all the patient, meaning their fluctuations, motor and non-motor, their quality of life, and if there were no other contraindications, maybe this treatment is indicated. Could be used.